I'm a daughter of a nurse, and I'm proud to be a mother of a nurse at the James too. So I noticed the doctors, the nurses, and the staff create an environment where the patients come first. And I wanted to be a part of that, and I wanted to be maybe a positive spark in a patient's life.
I wanted to go back to that hospital because that's where I grew up at. It's right in my neighborhood, you know, and my mom, who's passed away now, her and her twin sister, every time they went out to go shopping, they stopped at OSU East to eat down in the caf, you know. So it's like it's like part of, you know, the neighborhood.
I work as a researcher in the biomedical field, and that's really, in being in contact with patients has really given me more insight and just more meaning and purpose into why I do research. And just be able to tie that all together really kind of inspires me and motivates me to work even harder to hopefully have them benefit one day.
The second that I stepped foot in the NICU, I absolutely knew that this was somewhere that I wanted to be and something that I wanted to do, you know, not only for my own healing, but to benefit families and children, babies, and to help the nurses.
It's providing that one opportunity, perhaps at the front door when they first come in, somewhat a comforting face, a calming voice, a little smile, something that, or a helping hand, you know, that might minimize to some extent a little bit their anxiety, their fear. They all come in with a great amount of anxiety and fear, as you can imagine, confronting the battle that they have with this horrific disease. So I think if we can accomplish that in just one brief moment, provide them a little bit of comfort, a little bit of minimal anxiety, or reducing or anxiety a little bit, I think we've accomplished an awful lot.
Every interaction that I get, I take it as a new experience. You never know who you're going to help or and what their story is.
Being able to even make a small impact in the patients coming here or the family members coming here in a positive way, because I think often a hospital setting could be kind of scary or intimidating, but just, not even have to worrying about getting lost, or, if someone just offers you a kind, oh, do you need something? Even a question oh, they actually care about me, and maybe a hint of warmth. I feel like that connection you form with patients, or just the actions I can do to make their overall experience here slightly better, is the most meaningful to me.
It's so inspirational for me. I know what they're thinking. I know how they felt. And it was so important for me to have a positive attitude when I went through it, which I was able to have because of my family and friends. That's what I wanted to give the patients that I was helping as a volunteer. And the best part of it all is when I'd get that response back from a very positive attitude and a smile. And that's what carries me through.
The most meaningful part is just walking up on that second floor and seeing those patients, their families, their loved ones. I also had radiation treatment. I'm 5 years out, cancer-free, and just going up there, it's fuel for my soul.
For me to see the growth between the patient coming in and when they leave at the end of the day, and how they're more comfortable throughout the experience, reassures me that what I'm doing is right. And I think it's important for others to serve others so that we can establish a stronger community, both here in Columbus and beyond.
Contributing to the Buckeye culture of care that we love to have on our campus, and just the Buckeye spirit generally. I don't want to stop volunteering here, especially when I graduate and maybe come back for grad school.
When I walk through the door, they are happy to see me, and I feel grateful that I'm able to help somebody, that maybe I was able to encourage somebody.
I think we all come in with the idea that we're going to provide, we're going to help people and their families. But I think why we all stay, or at least for me, is what I get. It's that attachment that you start to get with patients that you see on a regular basis. It's watching these people come in with this incredible amount of strength, with this incredible amount of hope that they're going to beat this thing. And so that's what keeps me coming back.
You don't have to have been a care receiver or a caregiver to be a good volunteer. All you need is to have a willingness to help somebody who's just having a really bad day, showing up at the hospital and needing a caring heart.